What up, fam? I'm Dr. DeLuna, and you are listening to Drop It Like It's Doc podcast. Today, welcome to your Random Symptom Roulette. We're going to run through the body from top to bottom, talk about random things that you may have experienced before, and give you some insight as to what they may mean. All right, my friends, there's a myriad of things that could come up in this little flesh suit, aka your body, that you may or may not have wondered about. Know that so much of what you experience, yes, it may be common, but it doesn't mean that it's normal. It doesn't mean that it's healthy. And we're gonna run through some random things that my patients tell me and give you some insight as to what they may mean. Let me also pause and say that some of these symptoms that we're going to run through, when I describe what they may mean, some of them are pretty benign, pretty straightforward, might be nutritional or something like that. Some of them might be a little bit serious. So if you're wondering or scared or concerned that it's something serious, homie, I'm not your doctor. Like, you're looking at me through a screen. I'm giving you random health info. You got to talk to your doctor about this shit, okay? But if you're just using this for education, you came to the right place. Let's start with the head, the noodle, the brain, the cranium. So much stuff can go on here, but first let's talk about hair. Some of you love my hair. I appreciate that. I love my hair as well. You know, I used to hate my hair growing up, and I would wake up in the morning, shower, blow dry, straighten my hair all before high school. That is literally the dumbest thing that I've ever done in my fucking life. So I'm just gonna throw that out there. If that's you, stop doing that. But to hair, your hair tells you so much. And let me just say that if you have hair, some is gonna fall out, okay? It's normal for some hair to fall out, especially when you brush your hair, when you run your fingers through it, when you play with it. What is not normal is losing chunks of hair, losing spots of hair, because it's something that can definitely happen if you're losing a little bit of hair everywhere. Hair overturns, hair grows, that is normal. But if you're losing a concerning amount of hair, like when you brush it, you're having small animals in your hand, a little fuzzy pet, that could be a sign of quite a few things. First, know that stress is so good for you, right? No, we know this. Stress will literally fucking kill you. So stress can make you lose your hair. A sickness can make you lose your hair. Like, for instance, a lot of people after they got COVID, said the word, after they got COVID, they lost a lot of hair. That could be from a viral infection, some inflammatory messengers in the body that can make you lose hair. I don't know if you've ever thought about this, my sweet baby angel, but your hair is actually minerals. Your hair is actually protein. So if you are nutritionally deficient, if you're low in protein, if you're low in minerals, if your ferritin, which is a storage form of iron, is below 50, look at your labs. If you get labs done, I would recommend getting labs done. Hopefully your doctor even looks at your iron. Ferritin is the storage form of iron. And if you look at your labs and if it's below 50, and if you're like, why is my hair falling out, doctor? And they're like, I don't know, just start wearing wigs. It could definitely be because your ferritin is low. And fun fact for you, if your ferritin is below 50, you either A, have significant inflammation in your gut, B, have a parasito, or C, you might just be very iron deficient. You might have an internal bleed, that would be D. There's a lot of things going on there, okay? But you need to investigate why your ferritin is super low. It could also be because you're depleted in vitamin A, in copper, in vitamin C. These things are helping that storage mechanism happen, but truly you need to check out your vitamins and minerals. I see this so often in individuals who have ever been on hormonal birth control just because of how many nutrient depletions play into that. So hair loss is huge. Other things that could be going on if you're losing hair, it could absolutely be related to your hormones. So thyroid hormone, if you are globally low, this would be something like hypothyroidism. You might notice that your hair is falling out, that it's thin, that it's brittle, that it's hard for your hair to grow. You would also notice things like dry skin, brittle nails. That's pointing you towards the thyroid. However, what if you have greasy skin? If you have acne? If you have a beard out of nowhere, and if you're losing hair predominantly here in the bird's peak, I think that's what it's called, in the bird's peak. If you're losing hair there, it can mean that you have a hormone imbalance related to high androgens, things like testosterone, DHT, DHEA, all of these you want to look at. Got that one? Next on Random Symptom Roulette is going to be dandruff. Dandruff can be a few things. First of all, what does dandruff smell like? It smells like cheese. It smells like bread. It smells like yeast. Have you ever smelled someone that drinks beer nonstop and then the next day you're like, wow, you smell like a bread factory? That is yeast. That is sugar coming out of their skin. And know that you can definitely get a yeast overgrowth anywhere on your body, but on your head. If it is itchy, if it is, like the yellow, chunky, oily, gooey chunks coming out, that's probably a yeast overgrowth. This could be related to blood sugar. This is a truth bomb for you because we're going to talk about stuff in the nails soon. And yeast loves sugar. So if you notice that your head gets really itchy after you eat terribly, or if you know that you're just someone that has blood sugar swings up and down, every time your blood sugar peaks, it's going to feed organisms in your body, things like yeast. So you might get an itchy head. While we're on the topic of yeast, I'm just going to continue down the yeast bubble. Know what else you will get if you have a yeast overgrowth? You might get vaginal yeast infections. I promise you, honey, that is almost always due to a blood sugar imbalance, or it could be due to a hormone imbalance, things like high estrogen, an imbalance in different microbes in your vagina. We'll talk about that soon. But also, again, I'm on the topic of yeast, so I'm going to jump down to your little tootsies, your little pasta-finas, your little feetsies. If on your toes, if you have yeast underneath your toenails, if you have an overgrowth, and if you have that fungus on your nails that you're like, oh, I tried tea tree oil, it doesn't work. It's not going to work. It's not going to work because your toes, they're kind of an extremity of your body, right? Like they are the last point on this lower extremity. So if you don't have enough blood flowing to your little tootsies, feel your little pasta-finas. Are they ice cold? If they are ice cold, there's not a lot of blood getting down there. Of course you have some blood, right? Or else your feet would turn black, they would fall off. But you're not getting enough blood flow to your feet. And again, you could tell because they're probably a little bit cold. Your hands are probably a little bit cold too. You will 1,000,000% have yeast overgrow there. And that is because everything that you need to heal your body is in your blood. So if you're not getting your immune system down there, those vitamins, those minerals, those nutrients, those immune cells, things will overgrow like yeast. And that could be anywhere in your body. But this all started because we were talking about dandruff, right? This can also happen on your skull. Now we're back up to the head because your body is always detoxifying. And if you have backed up lymph in your skull, your body's gonna start to push out toxins through the skin. And it's usually pretty localized to the area in which you're having that backup. So if you have any toxic exposure that is in your cerebrospinal fluid, your body's gonna push it out and it could lead to things in the scalp, in the hair. So I want you to keep mind of that as well. So let's move down the line. Next thing, let's talk about the mouth. If you look at your tongue in the mirror, which I would invite you to literally study yourself, like a little science experiment, because your body is telling you so much. And that's what I do for a living. I literally study you. You come in, I study the way you talk, the way you breathe, what your skin looks like, how you smell. Like I literally study every detail about you, but you can do this yourself and learn these random symptoms. So if you look at your tongue, there's a white coating on your tongue. That's usually a sign that there's some maldigested food in your tummkins because your tummy and your gut, your digestive system, you can't really see down there, right? But you can see your mouth, and your mouth is that first window into your gut. So if you have a tongue that, first of all, seems a little pale, that's telling me about kind of the richness of your blood. You want a tongue that has color to it. If it's pale, your blood, which is giving that color is probably a little bit depleted with vitamins and minerals. So if you see the scalloping on the edges of your tongue, where you can see the indentations of your teeth, that's usually a sign that you're pretty depleted in B vitamins. But going back to the color, if you have a white coating on your tongue, yes, you can get things like thrush. Thrush is pretty dramatic in terms of yeast overgrowth. That's a candida overgrowth in the mouth. You would see on all surfaces of the mouth, it would be able to be easily wiped off. But if you just have a pale tongue with some white coating on it, you are not digesting your food well, and you need to listen to your body, because if you're not digesting your food well, fermentation will take place, and that will lead us to some other random symptoms in this roulette, like gas and bloating and diarrhea and stuff like that. What other stuff in the mouth can we see? Sores. Babes, one of my favorite cases ever in which I worked with a patient was that she had incredibly painful and diverse and diffuse cold sores in her mouth. She didn't have herpes simplex virus. If you have sores in your mouth, there's a cause for that. Know that there's always a cause for everything in your body, right, babes? Like, that's why I do this entire podcast, to educate you on what your body is asking for. But in the mouth, if you get sores, that's either a viral infection. It can absolutely be a different virus in that herpes family of viruses. That's what HSV1 is, HSV2. It could be something like mono. mononucleosis, the good old kissing disease. Truly, I see that a lot, that it can lead to sores in the mouth. So that is something that you need to look at, or you need to check your vitamins and minerals, chronic infections, things like that. Random symptom roulette. The next one is going to be swollen lymph nodes. You might have swollen lymph nodes in the back of your throat. You might, when you're looking at the back of that throat of yours, you might see that your tonsils are massive, and your doctor might be like, you could just cut them out. If you ever stop breathing because that's fully clogging up your airflow, we could just remove them. Bro, like that means that your immune system is acting to something, reacting to something. It could be an infection. It could be a toxin. It could be mold. It could be literally anything that your immune system is fighting against. So that is a random symptom that you are not ignoring. You all know this. I'm a fan of you keeping all of your organs, all of your body parts. So I would recommend keeping your tonsils and just finding out what it could be. Could definitely be mono though. Could definitely be chronic strep. Could definitely be lymphatic backup and buildup in your body. That's something I want you to look at. Next to the throat, changes in your voice. If your voice changed after you got sick or had a sinus infection or something like that, it could be because the goo is dripping down the back of your throat, kissing your little vocal cords, and your voice will be raspy. And that might be why you want to go and then your voice is clear. That is truly just mucus back there. You could gargle with some salt, take some herbs, you'll be good to go. But if you notice that your voice is just raspy and if it feels like there's something in your throat, and if this continues onwards, your thyroid's right here. That's your thyroid talking to you. And if your thyroid feels full, if it feels tender, more so in the center of your neck rather than on your sides, that's a sign of thyroid imbalance. It could be that your thyroid is inflamed. This is a place that autoimmunity frequently targets, so you need to check out your thyroid. If you are subscribed to this podcast, which you should definitely subscribe to this podcast. It's my favorite that I've ever listened to. But if you subscribe to this podcast, you've probably listened to my thyroid episode, and you know that there's a lot that can be going on there, and you probably know how that spills over into a lot of random symptoms that will be in this roulette, like your skin, like your hair, like your energy, like your poops. So you definitely want to be on a lookout for that. And you probably also learned on this podcast that most of the time, doctors are only screening you with TSH, which is a brain hormone, not a thyroid hormone. You need a full thyroid panel. If you need a little refresher on that, watch back on some of our episodes or one of our future ones on the lab test that I love. So other things in this random symptom roulette is chest pain. I know, scary. Okay, let me just say, right? If you're concerned about chest pain, if you feel like there's an elephant on your chest, if you can't breathe, if you're getting radiating pain, if you feel that doom is impending, honey, that's your heart, go to the hospital. Don't think about it. Don't be like, maybe I'll wait and search on PubMed. Go to the fucking hospital, okay? Your life matters, and we need to make sure that your heart is okay. However, if you're like, I get random chest pain that feels burny, or I get tender on the sides of my ribs, little different. You can get pain in your chest because you have so many ribs. You have ribs that are attached to your sternum, and they can move a little bit. So if along the side of your sternum you're getting tender or in pain, that's something called costochondritis. That's something that you can absolutely work on with someone that works on musculoskeletal work and see if you can get your ribs in alignment and stop that inflammatory response. It could also be that you had a cold a week ago and you were coughing your little lungs out, and now all these muscles are tender. You can also get chest pain from GERD, from heartburn, because as acid moves up your little tummy, it'll go into your throat. It'll cause that burning behind your sternum. So it is really important for you to kind of pick out those little subtle shifts. But if you're like, I randomly get chest pain after this or after that, it could be one of those two factors. But again, chest pain is something that you never want to mess around with, okay? Your life matters, your health matters. Maybe go to the doctor every once in a while, okay? Big fan of preventative medicine over here, just personally. Big fan of going to the doctor before something serious happens. But tell my family that they're still learning. So you might be learning too. Who's to say? Other random symptoms in this random roulette, my family, are changes to your nails. So look at your little Pasafinas. Your toenails will show you that. Your fingernails will show you that. If you have ridges longitudinally down your line, longitudinal lines down your nails, that's usually a sign that your gut is struggling a little bit. Usually a sign of a little struggle fest, predominantly with protein. So you don't want little waves in your nails. You want them to be smooth and beautiful. Also, if you're someone that gets your nails done all the time, I would probably just stop doing that because your nails are breaking down, right? And that's directly due to the toxins that you are putting on your nails every single day. Just throwing that out there. But the longitudinal lines are predominantly a protein deficiency. However, you can also get white spots on your nails. If you have white spots on your nails, you're deficient in zinc. You need zinc for a happy immune system, for happy hormones, for all sorts of stuff. You do. If your nails are brittle, mentioned this earlier, it's usually a sign of a thyroid imbalance. However, it could also just be that you are grossly nutrient deficient because your nails, similar to your hair, protein, minerals, all of that good stuff. Other things that we can chat about in our random symptom roulette is dizziness. Dizziness is complicated and complex because dizziness has a lot to do with blood flow to your brain, but also this organ in your inner ear called the vestibule. Isn't that fun? You have a nerve in your inner ear that is telling your brain where you are in space, but it's also helping you hear. It's cranial nerve 8, the vestibulocochlear nerve. Big word, big word. But if you have an imbalance in the right and the left side of those two organs that are sensing where you are in space, dizziness will present. So this might be you. If you woke up in the morning after sleeping, you get to sit up and you're like, oh, everything's moving. I don't know what to do. A little crystal in your ear probably came loose. Go to your chiropractor. They'll fix you right up. Very different than if you get dizzy from going from sitting to standing. That's more so a blood pressure thing. Because when you're sitting down, all your blood is kind of pooled in your center, and then you go to stand up, that blood pressure will drop. So if you tend towards low blood pressure, you're not gonna have enough blood flow to your brain. You're gonna get dizzy, you're gonna get lightheaded. You might even faint. Isn't that fun? Something else that can do that is blood sugar, absolutely. But also, let me just say that if you're dehydrated, your blood pressure is going to be not realistic or healthy. So you need to make sure that you are hydrated so that you're getting enough blood to your beautiful brain so you don't feel like you're gonna black out all the time. I remember when I was a vegan and I was a hot yoga teacher. I was quite depleted, and it's really hot when you teach hot yoga, and I would lean down and I would adjust students, or like massage them, back when I used to give a fuck about doing that. And then I would go to stand up. I would almost faint. There would actually be times sometimes where the entire room would go black and I'd be like, all right, you're gonna faint. One of your students is gonna find you, you're gonna be fine. Good news is I never did that, okay? Never did that, but just wanna throw that out there that if that's you, blood sugar, also your adrenals. Because your adrenals are what are managing your hydration, they're managing your stress hormones. That could play a lot into dizziness, lightheadedness, vertigo, or you need to look at your inner ear because it could be something else going on in that little chemical soup. Sometimes people get dizzy after they're exposed to things like pesticides too, just throwing that out there. And because all of you have watched my mold episodes, plural. There's a few different little pieces of mold on this podcast. You know that it impacts your brain, makes everything inflamed, will make you lightheaded, dizzy, confused. You'll feel like you have dementia. It's really cool. It's really cool when you have mold poisoning. Not like I've had it before. Just kidding. I have a few times. Super cool. Some other random symptoms that you may experience that you're wondering what they are. One is a unilateral abdominal cramp, either on the right or the left. It's a little twinge of sorts, a little tweezer wrapping around a fallopian tube and twisting. Just kidding. Have you ever thought of that before? Clearly I have. That random symptom that you get is actually around ovulation, and it is my favorite word in medicine. Mittelschmerz. Mittelschmerz. That's the name of this word for a twinge of your ovary as it releases your egg. So if you experience that one, know that that's not necessarily an issue. That's just your body talking to you. However, if around ovulation, if you get really bad cramps, if it takes you down, or if you don't feel well, you might have a cyst. You really might. Just get some imaging. You'll find out if you got a cyst or not, maybe many cysts. You can work on that with someone like me or another functional medicine provider. But if it's just a little twinge, it's called Mittelschmerz. You're gonna be fine. You are gonna be fine. I'm gonna do one or two other ones because I could literally talk about the entire body with you, but I think that you're gathering some good info from this little roulette of sorts. So, do you do the pee-pee dance all the time? Like all the time you do the pee-pee dance? You have to plan out what your day is gonna look like to make sure that you can find a bathroom? If that is you, please, my friend, find out if you're exposed to mold, because when I was exposed to mold, oh wow, the pee-pee dance was a daily occurrence for me. Because mold toxins, they get filtered by your body. Some of those toxins sit in your bladder. They're really irritating and they can make your bladder almost spasm. But also, mold is impacting hormones via your brain. It's decreasing a hormone called antidiuretic hormone, which makes it so that you don't diurese, you don't pee. So if you have low levels of that hormone, you're gonna be pissing all the fucking time. You're not gonna be able to stop it. And you're like, where'd all this water come from? It's pulling it from your body. You're getting really dehydrated if you're chugging water. Another reason why you might be doing the pee-pee dance all the time is because you're drinking water that has no minerals in it. We know that I'm a big fan of staying away from toxins. We know this, so you're probably drinking filtered water. The only thing that you might run into with filtered water, if it's a reverse osmosis, is that they pull all the minerals out. So if you switch to clean water, and if you feel thirsty all the time, if you cannot quench your thirst, you're probably mineral deficient. And you're just passing all that water through rather than absorbing it and then even going back to dizziness, that can make you dizzy. It really can. So check out that, check it out. It's very important that you're clearing out toxins, staying hydrated, but you don't want to be pissing in your pants. Last little symptom, because everyone loves talking about the vulva and vagina. So there's a lot of subtle signs and symptoms that your sweet little private parts are telling you. If the tissue of your vulva is pale, if you notice that that color is changing to more pale, know that that's probably a hormone imbalance. You might be low in estrogen or progesterone or testosterone. You're gonna wanna check that out because then that's gonna overflow into things like pain with sex or issues with getting lubricated. That's not fun, right? Check out your hormones. Other thing with the sweet little vag is that you might get itchy. You might get very itchy down there. Itching overall is usually a sign of a yeast overgrowth. We started this whole thing by talking about the head. If your head is itchy and yeasty, that's a yeast overgrowth on your head. If your foot is itchy, if your toes are itchy, you probably have some fungus growing down there. If your vag is itchy, you might have a yeast overgrowth. Know that yeast overgrowth is very, very common on hormonal birth control just because the way that it impacts the microbiome, but it's also very common in things like blood sugar imbalances. Honey bunnies, there's about a million other things I want to share you, and for some reason I have to share this one before I'm done. It just popped through. If you are someone that gets skin tags all over your body, and I'm thinking of this because we're talking about blood sugar, if you have skin tags all over your body, and if you didn't used to have them, and if they pop up, they can be on your eye, they could literally be anywhere. Know that you might have prediabetes, you might have insulin resistance. That is a sign that I never want you to ignore because that is a window into your metabolic health, and blood sugar impacts every system in your body. Energy, hormones, adrenal health, inflammation. You know, your microbiome is all influenced by this. So skin tags was one that I wanted to leave you with just so if you're like, what the fuck is this? I'm gonna pull it off. Know that it's gonna be really hard for you to pull it off. It's gonna hurt really bad, but you need to check your blood sugar. Well, friends, thank you for playing the game of Random Symptom Roulette. I hope that you learned something today. You know, I know that you did, but if not, it's probably because you're not subscribed to this podcast. So please hit the subscribe button. Let me know what you learned from this episode in the comments. Share it with someone that's got an itchy toe or hair that's fallen out or a tongue with white coating on it because they might have something to learn and something deeper to look into. Again, I'm not your doctor, unless I'm your doctor, right? But if I'm not your doctor, this is not medical advice. You need to work with someone that you can trust to investigate these little subtle parts of your health. And if you're looking for someone, I highly recommend looking up naturopathic doctors in your area, not naturopaths, a naturopathic doctor, which means that they have medical training, or a functional medicine provider, and they will absolutely be able to help you on this journey to health. I appreciate that I am a part of your health journey. Thank you for being here, and I'll see you very soon. Mwah.